My name is Abraham Peled. I'm a psychiatrist, and for many years I'm trying to promote a reconceptualization of mental disorders as brain disorders, trying to promote an etiological diagnostic approach to mental disorders and psychiatry. I will talk about networks and plasticity. Many years ago, when papers started publicating the idea of the plastic brain, plasticity is in general defined as the changes that occur in the brain when it is interacting with the environment and developing. And I noticed that you can frame plasticity in time windows, time scales, and try to overlap or put these time scales in relation to clinical phenomenology. So, for example, let's take a millisecond range changes that happen in the brain, the firing rate, the fast changes, which we can call now fast plasticity. And these happen when the brain is interacting with the environment, doing cognitive computations like thoughts, perception, memory. These things are activated in a millisecond range spectrum. And in the phenomenology of psychiatry, they are related to fast active pathologies like delusions, hallucinations, in short, like in the sense of a psychosis. So another time scale that can happen in plasticity could be adaptability, which takes like weeks to months. And we can now correlate that with the clinical phenomenology of mood disorders, because we know that mood disorders are changing over longer periods of time, and even, let's say, there is a good response to medication. It takes a month and a half for the medications to act. So we are dealing with time scales of weeks to months. And then the last time scale, which will be the longer time scale, would be that related to a lifelong time scale, meaning the plasticity, the changes in the brain happen in the brain since birth to adulthood. And this time scale of a lifetime scale is related to something that we find developing over this large time scale, which is the personality. And personality disorders would be incorporated in this time scale. So now, as you can see, we can talk about time scales and map them onto pathology that we find in a wide spectrum of mental disorders, ranging from personality disorders through mood disorders to psychosis. Now, on top of that, when we survey the literature, we find that there are also structural global network organizations which can be mapped onto the different spectrum of mental disorders that I just mentioned. So they might be related to mapping them onto timescales also. So in recent years, we know roughly that there is global brain organizations which were defined as networks. And the idea of a global network organization is very appealing because actually the mental disorders that we are talking about are emergent properties. And emergent properties in physics are the properties that the whole system has and the elements do not have. So let's take, for example, personality or personality disorder. One neuron or one neurotransmitter or even million of neurons do not have personality. The personality is something that comes up from the whole brain organization. Consciousness also. Mood also. So global brain organization is the way to go when you want to explain this kind of phenomenology in psychiatry. Now, the networks that we know about, as I said, are the executive central network, the default mode network, and the salient network. These are networks that have been described pretty well. And the executive network is related to working memory, cognitive functions, interactions with the environment, and that would naturally be mapped onto a millisecond range activity that we mentioned before. So we have a network and we have the time scale. Default mode network has been described as a resting state. Resting state means the basic condition of the brain, and also been related to introspective, when people are thinking about themselves, their internal representations, how they view themselves and others, and all of that is connected to what we know about personality disorder. So personality is who you are, what you are, your self-image, other people's images, and the way that you interact with the environment, and that would be pretty well mapped onto a condition which is basic to the brain. It's not something that changes, and it would be correlated logically with a resting state or a brain organization. Now, the resting state becomes an active network while the brain is not at rest, when it is required to do a cognitive function. So the network moves from a global organization of a default mode network to a central executive network. And these movements, activations, and deactivation, this movement is regulated by adaptability. The brain is adapting all the time by interacting with the environment and then incorporating this information to the resting state, basic state of the brain. And this flexibility has to be governed by hubs, subcortical hubs, which allow the movement, the flexibility between these states, and that would be the salient network. As you know, the salient network involves many subcortical, basal ganglia, and so on, hubs. So now we can conclude the big picture and see that we have brain time scales of plasticity mapped onto global brain organization, and that is mapped onto phenomenology of psychiatry. And it begins to give us a basic idea of what would be the etiology of mental disorders. We should look for etiology of psychosis in the central executive network organization in the millisecond range scale. We should look for personality disorder etiology in the lifetime scale and the default mode network. And we should look for disturbances, etiology of mood disorders in the adaptability dynamics related to the salient network in a immediate time scale of months to weeks.